Well, good morning and good afternoon, everybody. And thanks for joining us, especially for those of you joining on the Monday morning. As well, my name is Malaika, Cheney-Coker, and I will start the presentation and take us through to about halfway, and then Helen will take over from there. So it's, as Nadal mentioned, we'll be talking about some of our recent experiences in measuring gender in our water plus work. I should call them some of our recent adventures because it's definitely been an interesting road so far. Okay, so first things first, just to talk a bit about definitions. You might have seen the term water plus and have been wondering, what is the plus? Or you might already know what the plus is. So I will demystify that for you. Water plus is a shorthand that we use, and it is a term that covers both our traditional work in water supply, sanitation, and hygiene, which we call WASH, plus local management of water for domestic, i.e. household, small-scale productive, for example, agricultural, and environmental uses. So the term Water Plus really does enable us to link very well to the work of the Food and Livelihoods Justice Unit, or Food and Nutrition Security at CARE more broadly, through agriculture, nutrition, livelihoods, environmental protection, and climate change adaptation. So Water Plus is a very broad, encompassing concept. Okay. So this is our theory of change, which was created by the water team in 2010. I'll talk quite a bit more about it in a few slides. I know it's kind of hard to see. I apologize. But we have two axes. So the top horizontal axes, the first box says secure and sustainable access to water plus services. The second says gender-sensitive water plus policies, institutions, and social norms. And the third is gender-equitable control over water plus services. And the goal is poor women and school-age girls improve their lives. So obviously you can see that gender is very crucial and front and center in our theory of change. And then if you look at the vertical columns, alongside them you have health, education, environment, and climate change, and livelihood and food security. So it is intentionally a very cross-sectoral, multi-sectoral, cross-sectoral theory of change with a strong emphasis on improving the lives of poor women and school-age girls. Okay, so after we created the theory of change, it was in part a way for us to think more deliberately about how we organize our programming approaches, but it also brought up some questions for us. Because we realized that on the first two columns, the first one being more about sort of direct delivery of services in Water Plus, the second being about the institutions, policies, and social norms that sustain those services. The third is a more gender-focused one. And we realized that in many areas of the theory of change, but particularly the third domain on gender more specifically, we had several questions and didn't know the extent of CARE's experience in addressing these questions, or we did know and felt that there was a lot to be done. So here were sort of three questions that we will treat in turn throughout the presentation. So how have programs actually been doing so far in terms of our theory of change? What are the relationships between Water Plus and women's empowerment? And what are the differentiated results of our program within various categories of women and girls? So this is the first one. Again, I'm sorry that that's cut off. How have our projects and programs actually been doing in terms of our current theory of change? So, you know, we were connected to quite a number of projects and programs around the CARE world, but not the whole breadth of the portfolio. And it was a new theory of change, so we felt that we needed a process to help us better evaluate how our work actually stacks up against the theory of change. And one of the major efforts we did to evaluate that was the Water Plus Impact Report, which you may have seen. It was released, I believe, about a month and a half, 2 months ago. It was released in April. And it took about 4 months, and it was a team effort to produce it. In order to do the analysis, we reviewed 51 documents, which were project evaluations, final reports, case studies, any report we could get our hands on from across the career world that described the results of programming. So they were from all regions, and we looked at documents between 2006 and 2012. So that would have been the reporting period, but sometimes the programs reported on were executed prior to that. The methodology was very simple. We developed a scoring tool based on each of the domains of the theory of change, and there were certain aspects of each of the in the scoring tool that we looked at, and I will show you the one for the third domain on gender in a bit. But it was fairly subjective. It wasn't, each criteria had a specific number, but it was that each of us reviewing had to give it sort of an assessment based on how well we thought they covered each of those criteria of the tool. And then, of course, we averaged out the scores for each domain. So this is the theory of change again, just the top line showing the domains. And as I mentioned, gender is very explicit in the theory of change, but that's because gender is very much tied to water. Women and girls are often the ones most affected by lack of access to water, whether for productive or domestic uses, and lack of access to sanitation. Women and girls tend to be the ones that bear the burden of collecting water. Women, most smallholder farmers, particularly in Africa, are women. So, of course, and water is very much tied to agriculture. So there are just many, many areas where water and related services and gender issues intersect. I'll mention one more, is that in schools, girls are very much affected by lack of access to clean facilities and like latrines and wash services, so that does affect girl attendance more. The theory of change loosely maps to the women's empowerment framework, which, as I'm sure pretty much everybody knows, is agency, structure, and relations are the three components. And so, for example, we think about the third domain, the purple box, as being mapped to agency, and let's say structure would be well mapped with the second box as another example. So, let's see. We really wanted, like I mentioned earlier, to find out more about the third domain, and here are the criteria that we used to score the domain as we reviewed each of those 51 reports that I mentioned for the impact report. So we looked at whether the program addressed gender equity, whether it built individuals, and this was both male and female, ability to manage their water resources for both productive and domestic purposes, and whether it empowered people to articulate their water needs, water plus needs and aspirations. So we were looking more generally at individual agency and ability to, the ability of communities and individuals to lead their own development, but we did so through a gender-focused lens, and we're very interested in efforts to build women's empowerment or address gender equity more broadly. The overall score we gave for our work in this domain was 4 out of 10. And just to give you a point of reference, our score for the first domain, which was unsustainable access to wash plus services, that was 6 out of 10. And on the second, which was on the policies, institutions, and norms, we gave that a 4 out of 10. So this domain was one of the two lower scores, but it wasn't too far from the others. So why did we give it that score? Just to give you a bit of context, first of all, there were very few indicators used for gender, and most of the progress was reported anecdotally. So gender was mentioned in several of these evaluations, or as in, women's capacity was built, or there were more women on committees, but in general, I should say there were not many indicators used in these evaluations, let alone indicators that were consistent across evaluations, and most of the indicators used were focused on WASH primarily, as in not so much even on the other components of Water Plus that I talked about earlier. So most of the programs where there was a mention of gender, they contributed to the criteria that I put up on the previous slide through things like the programs or projects helped informing community groups and ran them through training sessions on organization, decision-making, governance, and financial management. And we felt that these things should be given scores and points for those things because they can be said to be empowering. Many of those groups were women's groups, and so we accorded points for things like that. And several evaluations did note specifically some results that were favorable to women and girls, such as the decreased burden of fetching water, and then the benefits of more time that followed on from that. Girls increased attendance in school, things that seem simple but are important, like a cleaner personal appearance, and women feeling more empowered and confident about their voice in the community and their ability to take decisions publicly, and things of that nature. Okay, so to give you more specific examples, this is pulled from two different evaluations, so verbatim. So you can see, for example, all interviewed women had expressed that the continuous access to improved water supply had directly reduced the burden of ensuring the availability of water inside the household for daily needs. And then you can see some of the improvements mentioned. So, like I said, it was sort of a very anecdotal type of reporting, and that's what we saw most consistently. We didn't really see many indicators. And then there was one where there was a secondary impact indicator, which was fairly unusual because usually women's issues did not make it into the law frame. So you can see this was women's associations are successfully managing water quality maintenance. So there were a handful of those, but just very few and far between. There was, thankfully, one exception, and this was the CIWASA, which I think is Community Water and Sanitation project in Rwanda. And this project was explicitly a WASH project that took a gender equity approach. So, of course, we were quite excited about it. And here are some key components of their approach. They trained hygiene focal points, both male and female, to promote WASH and gender equity using FAST, which is a methodology for promoting a participatory hygiene and sanitation transformation methodology. So they use a method that would be very familiar to those of you that work with gender mainstreaming approaches in programming. So they focused on finding sort of engaging men and boys, essentially, and finding men that were already more on the edge as far as progressive attitudes to helping their wives with household chores. And they also targeted men that were on the other end of the spectrum that were less supportive of those types of more gender flexible roles. And so they use the quote-unquote engaged men as influencers for the other men and to change community perceptions in general. So you can see in the picture on the left that's actually a skit, and that's, I think, maybe even a project staff person, but is that man is just miming doing laundry. And the other guy is fetching water, which, as we know, is traditionally not something men would do in most communities. So, thankfully, CIWASA, as you might expect, had some very specific indicators to do with gender within the project. So you can see, for example, percent increase in women leadership of established or rejuvenated and equipped functional water management committees, which is very specific. Percentage of women reporting that their interests and priorities are prioritized by water management committees and cooperatives. And then you can see some other indicators to do with men sharing wash tasks with women, men serving as positive male role models, etc. So SIWASA was one example of what could be, particularly in projects that are more explicitly include a gender component. Okay, so conclusions to this first question, which was about how do our current projects and programs stack up against our theory of change, particularly in the case of the impact report, and for this discussion looking at the third domain on sort of gender equitable control over water plus resources. We concluded that there was good awareness and fairly regular mentions of gender issues throughout the reports that we reviewed. But a few of the initiatives surveyed for the impacts report used tools for analyzing social structures and power relations, or disaggregated the benefits of services by gender. And few of them employed empowerment methodologies, which would have benefited probably both men and women, entire communities, essentially. So we felt that the awareness was there, but most projects and programs needed to take the next step to actually use some of the great tools, for example, that have been made available by the Gender Empowerment Unit, or analyses of power structures as it relates to gender, which we know CARE has some great tools for that. So that next step was just not there. And this was seen in the programming, not just the analysis. So the activities to address gender equity issues were fairly conservative and didn't usually go beyond the usual effort of trying to get more women on water user committees, which is important, but we felt a lot more could have been done. And in some cases, there was also, targeting towards trying to get women involved in savings groups and linking those with WASH. But it didn't usually go beyond that. This lack of deliberate integration of gendered sensitive approaches within the programming was mirrored in the evaluations, with almost no explicit objectives related to gender and thus few indicators. So as I mentioned, what I just said was reflected in the fact that there were very few gender-specific indicators also. Okay, at this point I will turn over to Helen, who will take us through the next few slides.
Thanks, Malaika. Can you hear me?
Yes.
Great. Okay. So we in the water team have then become involved, actually starting a few years ago, in trying to better understand the relationship between water plus and women's empowerment. Next slide. And one part of this was a study that we undertook in Ethiopia in 2010. And as well as the usual questions on, questions such as, was there a reduction in time taken to collect water, and was there any health benefits and so on, we actually explicitly looked at questions such as empowerment. And the findings of this study was, for example, that 76% of women responded feeling more equal as a consequence of this water-related project. 68% felt that they had a greater sense of control over household resources, and 67% also reported increased feelings of respect and dignity. So what we were trying to do there is explicitly ask questions not just about the sector, but about the impact of the sector's work more widely on women's empowerment issues. And what we found was that those, possibly to be expected, but that those who are most engaged in some of the management and governance issues, for example, those who were involved in WASH committees, or had direct income generation opportunities, reported more significant changes. Now, another study that we were involved in was a very large SWASH project in Kenya, and that had some gendered analysis attached to it, and it was a much more statistically accurate and detailed approach to the whole study of water issues. And one of the findings from that study was that up to 58% reduction in girls' absence, or an average reduction of 6 days per year per girl, as a consequence of having improved wash provision in schools. And I think having statistically very strong, in this case really strong, because Emory University were involved in the detailed statistical analysis, having such data to be able to have very clear impact statements on gender issues is really very powerful. There's other work that's been done that started to tackle things such as menstrual hygiene management, which has a massive impact, not just on health and hygiene, but on things such as girls not going to school, and so, future impact on their lives, and also all sorts of other things such as pregnancy and limitations to their opportunities. So again, it's a question of sector work, starting to look beyond the obvious to analyze impact at this higher level. Next slide, thanks. So another question was, it's all very well, we keep on talking about the impact of Water Plus initiatives and many other initiatives. So I don't know what sectors you're involved in, those of you who are on the line or in person at the meeting, but whatever sector we come from, we often talk about benefits to women and girls, but to what extent do we disaggregate which women and which girls? So this was a study that we undertook to try and look at that question. Next slide. And the reason for that is that, again, we often just say women benefited or girls benefited, but we know that experiences are mediated by age, position in the household, wealth, disability, etc. And the question is, how can we really understand that better? Next slide, thank you. So we have a simple snapshot tool, which has evolved over time, and we administered this in East Africa. And it's primarily a quantitative mechanism which asks people to rank their views about a set of questions, and there's some qualitative aspect to it as well. And we tried to look at who was answering the question. So we had, in this case, 53% were married, 22% were single, 18 widowed, 7 divorced. And you also can see from the chart other aspects of their backgrounds to do with where they fit within a household. Next question. And then we asked questions such as time taken to collect water, amount of water used, hygiene benefits, the obvious ones, but also issues such as relationships, change in leisure time, and their sense of change in their voice. Again, a bit more detail here about the tracking who we were speaking to and what they were therefore saying. And what we found was that, so take the questions such as dignity. The question was something like, to what extent has there been an effect on your sense of dignity? That was rather poorly worded. I could find the exact question, but the response was that 86% felt that there had been a positive change. And what we found that it was that it was primarily the heads of household that reported this positive change. Elderly relatives, young dependents, and other adults in the household didn't really prioritize or didn't report back on a change of dignity, which we thought was slightly surprising given the sanitation effects, which we thought had to do with personal dignity. But I think what this finding was generating was that actually for many people, the dignity of the household is the important factor, and for those who are responsible for the welfare of the household, they felt that more. Another question was around leisure time, and 74% of people felt that there had been some benefit to their leisure time. Similarly, time for socializing, 77% reported improvements. But we found that statistically, it was the relatively poorer women who were more likely to report these changes compared to middle income or higher income women. Same point about equality. So 80% reported benefits. And interestingly, disabled women statistically were more likely to report this as a benefit compared to non-disabled women. in general, we found that on the committees, married women in particular, but also widows, were more likely than single women to take on this role, and that women with young and old children were more likely than women with no children. Now, this might not be, in a way, this is obvious. What this is saying is that those women who are at the center of their life cycle and household-related dynamics and are at where society values them most are the ones that end up being involved in the committees. Those are the ones who are selected as committee members. But the question is, the fundamental question is, are they the best, the most efficient selection, the most beneficial choice for who should be a committee member? In other words, those who are already very, very busy in many other social and household roles. Is that really the best option for your committee member? And likewise, is that the most transformational from an equity point of view? Are you just reinforcing social norms and giving opportunities to those who are already well established, rather than looking at ways in which it might be those who are more marginalized within social networks, within their communities, within their household dynamics, who might actually benefit more? So a few lessons from the approach. Firstly, that actually quite simple tools can go beyond the obvious comment of X percent of women reported benefit in terms of reduced time for collecting water, for example, but could also start asking more interesting ones, such as the question around dynamics within the household and community, and more complex ones in terms of who exactly is reporting what kind of benefits. And that by asking those questions, you start to improve the work that you do. You start to possibly, arguably, target better and understand better the impact of your intervention, whatever it is. I mean, in this case, we're talking about Water Plus, but I think the comment applies more generally. And we've done this very much on the cheap with small snapshot tools without really doing enough statistical sampling approach, without as much rigor. And also, I think we're aware that the questions have a positive bias because people know why we're asking the questions. The tendency is for people to say, yes, it's benefited us, although we can still unpack that benefit to find out who's saying more so or less so. So I think it's still valid, but clearly more detailed approaches and more rigorous approaches are needed. But I think it's no excuse not to do even some studies on the cheap and on light-footed. And then a call really is sense that we need to embed these gendered research and gender questions from the gendered element on the log frame through to also having gendered research in the thinking as well. So not just strengthening methodology. And we've also undertaken some other studies which have just started, and we don't know the results as yet. But again, trying to look even more explicitly at issues around gender equity and the extent to which a stronger gender approach might actually result in better programming in terms of Water Plus effectiveness. One of the studies that we're undertaking is in Ghana and Burkina Faso with a newer version of these same quantitative snapshot tools. In fact, two tools. One of them looks at governance and finance and functionality issues, and the other hones in on gender questions. And then we're also accompanying that with a more qualitative focus group discussion approach that can probe further on the quantitative data that we're generating. There are also some other studies. There's one in Mozambique that we're looking into, and there's other opportunities in Mali also to explore some of these questions, hopefully down the line. So overall conclusions. The first is that we need to show that Water Plus programming supports women's empowerment through the very complex interrelated ways. I think sometimes people think of water as generating just one benefit for women, but actually beyond the reduced drudgery, there's a lot of other opportunities, a lot of other benefits that could come from it. The possibility of transformation beyond is quite clear, because there is an acceptance of women being involved in this whole sector, so you can use it as a way to get women involved in the public sphere well beyond water plus issues. So we're calling really for gender-specific objectives to be top line within results framework, and to have gender-specific indicators. As Malaika mentioned, there are very few projects that have either clear gender-specific objectives or indicators, and it's important to be able to have clearer methodologies and clearer data on this whole area. Next. Also a call for disaggregating women's experiences. They are women experiencing very, very dependent on household compositions and their position in terms of life cycle and community issues. We need to understand those much better and embed that into our analysis. I think we finally a link to what I said earlier, a call for golden common indicators, so that we can speak across different projects, across different countries, and have a louder voice on both the impact and the benefit, but also how to do better. Next slide, final slide. So if you'd like to know more beyond this call about the specific studies that we've talked about, they are online on the Care Water Wiki. And also, we're really, really keen to hear from country programs who are interested in developing more integrated and gendered water plus programming or policy influence work. Also very keen on doing more research and learning, and we'll be happy to work with country teams to explore these issues more. And finally, to develop common indicators so that in 5 years' time, the impact report can be much stronger in its findings and in its recommendations. So we're calling for people to get in touch with us if they're interested in working in these areas. So thank you very much for listening, and I'll hand you back to Malaika.